When you're dealing with an endocrine emergency like a diabetes crisis or a parathyroid imbalance, things can go south, and they can go south fast. Every single minute counts. So let's talk about how the CSMRN framework helps you get a handle on these metabolic crises with the speed and the precision you need.
And I'm not exaggerating here. The stakes are as high as they get. Confusing these conditions isn't just about getting a question wrong on an exam. In the real world, on the floor, it can have absolutely devastating consequences for your patient. The pressure to get it right is just immense.
And this is exactly where so many students and new grads get tripped up. It's such a common struggle to tell these complex states apart, especially when you're under pressure. You might have the textbook definitions memorized, but actually applying that to a real person or even a tricky exam question, that's a whole different ballgame.
So I want you to ask yourself a serious question. Are you just memorizing numbers, or are you actually building the kind of solid clinical judgment that lets you see the whole picture and act with confidence? Because that right there, that's the difference we're diving into. Okay, so let's jump right in and start decoding these glucose crises. This is one of those areas where having a really solid, structured way of thinking is an absolute game changer, especially for telling apart two very dangerous hyperglycemic states, DKA and HHS. Now check this out. This is where it all starts to click. Instead of just a jumbled list of symptoms, we can start to see really clear, distinct patterns. You've got DKA, usually in your type 1 patients, with glucose over 250, that metabolic acidosis, and of course, that classic fruity breath. Then, on the other side, you have HHS. This is usually in type 2, with crazy high glucose, we're talking over 600, and severe dehydration, but critically, no ketones. Seeing these patterns is the first huge step. All right, let's put this into practice right now. Picture this. A patient walks in, and you notice that very specific fruity smell on their breath, and they're taking these rapid, deep breaths. That's Kussmaul breathing, right? The body is desperately trying to blow off acid. So what pattern does that immediately scream to you? Yep, it's a textbook sign of DKA. And this is exactly what I'm talking about. The answer isn't just on the glucometer. It's in the way the patient is breathing, what their breath smells like, their whole clinical picture. The CSMRN approach is all about training your brain to connect all of these critical dots. Now, what's really cool is that this same principle of pattern recognition works for more than just glucose. It's just as vital when you're trying to spot other life-threatening electrolyte imbalances, especially when it comes to calcium and sodium. Here's another perfect example. We've got two conditions that sound super similar but are total opposites. With hypoparathyroidism, you get low hormone levels, which leads to low calcium. What does that look like? Muscle twitching, or tetany, numbness, cramps. But on the flip side, hyperparathyroidism is too much hormone, which causes high calcium, putting the patient at risk for things like bone fractures. When you see them as a pair like this, they become so much easier to tell apart.
So let's try another one. Your patient is complaining about that telltale numbness, and you actually see tetany. What pattern should be flashing in your mind? Well, that's the classic presentation of low calcium, which points you straight toward hypoparathyroidism. See how that works?
And we're not done yet. What if the pattern you see is extreme thirst, polydipsia, and their labs show a really high serum sodium? Well, now we're not talking about a glucose problem at all. This is a completely different kind of fluid balance crisis, and it points right to diabetes insipidus. Different patterns, different diagnoses.
So what does this all boil down to? This is the core advantage of the CSMRN approach. It's a system that's designed to take you from just trying to memorize facts to achieving true clinical mastery.
It all comes down to this really powerful three-step formula. First, you learn to recognize the metabolic patterns, like the fruity breath in DKA or the muscle twitching with low calcium. Second, you interpret what all those clues mean when you put them together. And finally, and this is the most important part, that clarity lets you prioritize the interventions that are going to save a life. This is the kind of thinking that helps you crush your exams and excel at the bedside. Because, at the end of the day, this isn't about just teaching you stuff from a book. We train you to think critically, to interpret these crises as they're happening in a real person right in front of you before it's too late. That timely recognition is what saves lives. Look, what we just went through, that's just a little taste of the CSMRN method. The full, in-depth framework that will help you master all of these complex disorders is waiting for you. And remember, building this kind of clinical judgment isn't just about passing a test. It's about becoming the nurse that your patients can truly count on when they need you the most.